So Pints Policy is back. This time, healthcare. Why is it so expensive? Very, very important question that I think is on the front of everyone's mind, especially coming out of COVID. Nothing got cheaper through COVID, and healthcare definitely is a prime example of that. And it's great to hear, like, you've got a couple experts coming tonight to Great North Aleworks. This is Greg Moore, State Director for Americans for Prosperity in New Hampshire. This is presented by AFP. Please be sure to check out AmericansForProsperity.org to learn more about their work. So what's the goal of tonight? Who are these people you have come to present?
Well, we have a couple people. First of all, we have the Vice Chair of the House Health and Human Services Committee, Representative Layon from Derry. She obviously comes from a background in healthcare. She did a lot of healthcare research and reporting, and I think that from her perspective, she can bring a policymaker's view to some of the policies that maybe aren't optimal and can be improved. We also have Jared Rhodes, who works up at Dartmouth. He's a researcher at the Institute for Health Studies and Research. Actually, he's from the Dartmouth Institute of Health Policy and Clinical Practice. So I want to make sure that we get that accurately reflected. But Jared is an expert. He's been a researcher in the healthcare space for many years, and he's great at crunching the numbers and coming up with some of the things that are driving some of the opportunities from a policy perspective that New Hampshire might be missing out on, and some of the ways that we can improve and optimize the overall healthcare system. Because people are really taking in the teeth when it comes to healthcare. When you look at healthcare costs, New Hampshire has some of the highest out-of-pocket costs in the country. Depending on the year, we go anywhere between like first, second, or third in the rank.
Not good. Not ideal.
Not good. And so New Hampshire residents are really paying a lot of money for their health care. The good news is we're a relatively healthy state, but we're still a state that it costs a lot of money to be healthy.
Now, I'm going to be having Jared definitely talk about this report here, Enhancing Healthcare Options in New Hampshire, the Direct Pay Pathway, which I read a little bit on this before talking to you, and it kind of surprising stuff in there. I mean, what were some takeaways for you from what you guys are doing that may be of interest?
Well, there are challenges throughout at the federal and the state level of trying to find ways to maybe reduce some of those costs, some of the policies that are in place. One of the biggest challenges is posed at the federal level, where you have situations where Medicare really drives the boat. Because if you look at a typical hospital's balance sheet, more than half the money typically comes from the Medicare program. And then you add on Medicaid and other government health insurance programs. And so these hospitals are following the incentives that are laid out for them, which is trying to maximize the amount of money they get from these government healthcare programs. And that really drives a lot of what goes on. In fact, one of the places where people are making some of the most money in the healthcare industry are what is called revenue maximization specialists. These are highly trained consultants who come into a hospital, and they try to figure out how they can get the hospitals paid more for doing the same thing they're doing right now. And I mean, if you think about it, that really drives up a lot of costs. Mm-hmm. And then, but also working in and around these government health programs has an inherent cost that it adds. An independent physicians group said that the right number of billing specialists for each physician, practicing independent physician, is 2 billing specialists. So think about the overhead you're adding to healthcare if every doctor has to have 2 billing specialists to come up with all of the numbers, just because of the incredibly convoluted government healthcare system. And that's a system that everybody has to operate in, because the majority of the money in healthcare is in there. And so there are some places across the country that are saying, you know what, we're going to get away from that. We're not going to take Medicare. We're not going to take Medicaid. We're just going to take direct payment from consumers. They're not even going to take private insurance. They want to work and get back to for a lot of the practitioners, a lot of the reason why they entered the practice, to not worry about having all this cumbersome bureaucratic overhead behind them, and instead just focus on providing the best care to keep the patients as healthy as possible, and then there's a direct payment. There are a number of things that are sort of getting in the way of that. At the federal level, the tax deductibility going to the employer, not the individual. So we need to make sure that the individual gets a tax advantage status on health care versus just the employer. So the employer is making your health care decisions as opposed to the individual working directly with the doctor. So we have this third-party payer. And that's also true for government as well. And what we found is those people that are going down that pathway, and we have some of that here in New Hampshire. We have individual physicians who are offering care directly for them, and that care is much cheaper. we're talking about in some cases where they're charging somewhere on the order, the physician's charging $150 to $200 a month for direct primary care. And I think that direct primary care model is great, but it's a barrier we have in New Hampshire is at the facility level. So while you can do it at the individual level, the practitioner can do it, a facility in New Hampshire, you cannot open a medical facility, whether it be a MRI or maybe a ambulatory surgical care. You can't have that in New Hampshire, and you cannot get a permit or a certification to open unless you agree to take Medicare, Medicaid, and all the other private insurances as well. And fundamentally, we think we need to provide more flexibility, give people more opportunities to actually access the direct payment method. So that's one area. Another area that we really look at the federal level are things like the issues of prescription drugs. Mm-hmm. And prescription drugs is a huge issue for many people, particularly a lot of seniors. But prescription drugs, so just for example, the FDA process and the patent process. Well, that patent starts when you make the drug, but you might not get FDA approval for 5 or 6 years. Mm-hmm. And so you only have the remainder of that time to make your money. So they have to jack up the drug costs. Another issue is potentially an issue in the foreign policy space, because the American taxpayers and American consumers are paying for almost all the R&D costs for the world. It's because all these other countries have these national social health care systems, and they will only pay the actual cost to make the pill. Well,
and I want to reinforce, I've spoken to many lawyers in the patent and technology space. That's 100% the case. So we're talking politics here a little bit, but this is important on the legal side here too.
Right. So you're in a dynamic where American consumers and taxpayers are having to fund all the research for the world. And that hits us. That's another cost that hits us as well as it relates to things not just on prescription drugs, but also a lot of medical devices as well, where those costs for R&D have to be borne by us. Mm-hmm. So this is a case where I think that people running for president here in New Hampshire, we should be asking the candidates for president if they're really interested in trying to find ways to reduce healthcare costs. Is this one of the areas where we're willing to put pressure on those countries with social medicine? Medical systems today? Listen, you got to pay up a little bit too. We don't have to carry all the freight for everybody, and so I think that's another area to look at. But also, again, back at the state level, we have a dynamic where the vast majority of the land across the state of New Hampshire, you can't build a healthcare facility, because in 2016 a law was passed that said that if you have a critical access hospital, then you have essentially a 15-mile exclusion zone where nobody can move in there. Hmm. So you have basically a monopoly in that space. And that's another area we think that people should start looking at. Another example is if you wanted a hospital in New Hampshire, it doesn't matter what kind of hospital, it could be a specialty hospital, and under New Hampshire statutes, a hospital means a place where you stay overnight. If you're staying overnight, you need either a hospital license or a skilled nursing facility, i.e. nursing home license, if you want to get that. So if you have anything where someone would be staying overnight, then you're in a dynamic where you need a hospital license, and under the law that was passed in 2016, if you want to get a hospital license, you have to have a 24/7 emergency department, which is the most expensive area.
Yeah.
So these are some of the policies that we're looking at that are driving healthcare costs forward, both at the state and the federal level. And there are some other reasons why healthcare is expensive. Here in New Hampshire, we have a lot of other competition for medical professionals. We have a thriving biotech sector, both here in New Hampshire and just south of the border in Massachusetts, and that absorbs a lot of the people who could potentially be practitioners, and potentially they might get a more lucrative job working in the biotech space. So these are some of the issues that we're exploring today, and we're going to be talking through and trying to get to some of these root causes, and particularly as we have people here who are going to be members of the legislature, give them some ideas for some potential legislation going forward.
Now I'm joined by New Hampshire Representative Erica Layon. Thanks so much for coming to this event today. I'm excited to hear what you're going to be saying. What's your background, and what does that help you to be informed in what we're going to be discussing today?
So I have a degree in economics from MIT, and I started off trading options on the stock exchange out in San Francisco, I ended up moving to be a medical device analyst for almost 15 years, covering companies that make implantable devices, orthopedics, cardiology, neurology, diabetes technology, a whole bunch of different areas in the healthcare space. So I've been to all of the American Heart Association, all the orthopedic meetings, everything else, as we transition from the old model, where there was still some free market in there, to the new post-Obamacare market, where this whole thing is consolidating into the system that's going to strangle us all.
So what can we do at the state level? I mean, it's a big thing I love speaking to representatives and senators here at the state level is what can we do from a policy perspective that maybe can make some changes productive for everyday Granite Staters?
So some of the things we can do are cash pay hospitals. We have cash pay for physicians now, so you can go to a primary care doc and pay cash. We don't have that for facilities. So whether you're talking a hospital or an urgent care or anything else, once you get beyond that level of basic physician practice, you need to go into the whole insurance racket. And honestly, that's what it is. Medicaid always pays 6% less than the next lowest payer, and all the other insurance companies are based off what you pay. So sure, you can go in and get a cash discount, but still, you shouldn't be getting a $1,000 bill on the top line and then only have to pay $400 for cash pay. Let's get some transparency back and make it so that the actual people getting service are the consumers of healthcare, not some big payment scheme.
So there's been a lot of focus politically and from a health policy perspective around price transparency and aspects of that. Do you feel like that's been making any dent in the situation, or is it basically there's much bigger fish to fry in this?
Honestly, while you still have this whole insurance model where they're keeping all of their prices in the dark, you're not going to get true transparency. Sure, you'll get the $1,000.88 it cost when my son broke his finger and we went to urgent care, but you won't know what you're actually going to pay at the end of the day. So it just remains totally unclear unless you can have a model where you're only selling healthcare to those people using healthcare. Because when it goes to the insurance companies, it'll never be clear. Their business model is to make it unclear so that they can provide those services.
How do you make this bipartisan? Nothing, like, it's so close right now still.
Yes.
There's no way around it. Fortunately, we still have Governor Sununu here up until through next year. But what do we do that can kind of bring everyone together a bit to at least find some compromise?
Some of it would be looking at pharmacy benefit managers. So the PBMs, they were basically created through authorization through government to get these rebates from drug manufacturers, and that was supposed to go back to the patients. But it's not. It's actually going to line their pockets. When I was on Wall Street, I had the opportunity to cover those companies, but I couldn't in good conscience do that because I knew that they were going to make a lot of money and make investors money because they weren't going to follow through on why they were created. So I'm hopeful. I think somebody else introduced a bill on PBMs and trying to get to a little bit more of the root cause there, but it's such a complex issue that it's going to take more understanding. We're building more people on both sides of the aisle that understand it, and right now hopefully there'll be some movement at the federal level on those, and we just need to keep trying to mostly increase awareness and move towards that point where we can actually do something for free market health care and eliminating those advantages that were misused.
Coming up on the primary, what in your opinion are some questions that Granite Staters should ask these candidates when they're coming through, whether Democrat, Republican? I mean, all these people are going to be running again for president. I always say that on my show. It's like, yeah, there's a dog and pony show when it comes to a lot of it, but a lot of these people are going to be returning to the state again in 4 years and things like that. So to put bug in the ear of these candidates, what should they be asking?
I think the biggest question is whether experts should make decisions for people, especially on their health care, or if the individual should make decisions with the help of experts. That ultimately is where we went wrong in COVID, is that we followed an idea and we didn't actually follow the science, and there was a lot of really bad policy that came downstream. The problem is right now medical providers, they're all selling to hospital systems and not to doctors because doctors aren't independent anymore, so they're making the decisions at the hospital level. And as we have them at the hospital level, it's going to be a lot harder. So I want to know from these candidates how they're going to make sure that they empower individuals to be knowledgeable patients that are involved in their care, as opposed to somebody going through and just getting treated by the machine.
Excited to be joined, lastly, for today's episode with Jared Rhodes of Dartmouth Institute for Health Policy and Clinical Practice. Thank you so much for joining me on this. And excited to hear what you're going to be saying during today's presentation, because you're enhancing healthcare options in New Hampshire, the direct pay pathway, which which is this online somewhere so people can check that out?
Yeah, probably the St. Anselm website will have that.
Okay,
so,
cool.
Yeah, you can find it.
I'll link it in the episode description if you want to check it out. It's very readable. Big thing when I see some of these academic reports, I'm like, oh God, I don't understand what you're saying. This is very readable, so I highly suggest you check it out to get informed on this, because to be honest, direct pay is something I never really took that much consideration of, but what kind of led you to think about this as something that lawmakers and such should start going down the direction of at least thinking about ways to integrate it?
Yeah. So I mean, direct primary care and then direct pay more broadly it's just one of those, I think, promising areas. It's not a brand new. Well, most of the parts of it aren't brand new. So, for instance, the direct primary care, that's been around for 10 plus years. In some sense, it's been around for much longer, if you know, depending on how you define it. And so certain parts of it are already kind of well functioning, and that's good. But there are things that we can do, though, I think, to kind of give it a boost and make it a more powerful alternative to kind of what the status quo is health insurance wise. And so seeing that it sort of exists but could be improved, and some of the obstacles I think could be taken away to make it flourish a little bit more, I think that makes that kind of one of those policy windows is just right for it. It's something that's not so far down the future or down the line that it's like futuristic and not feasible.
Yeah.
But it's also something that I think would make a big difference. So that's kind of where it stands at the moment.
So what sort of data do you use to establish some of these numbers that you see in this report?
Yeah. So for instance, the direct primary care component of it, that was literature review kind of stuff. Trying to figure out what, for instance, there's a couple tables in there. One of them gives account of what the estimates of how many direct primary care practices there are in the U.S. And so that kind of establishes a trend. You can see the different estimates over the past 10 years. There was 175, and then up to 200, and 300, 400, and we're over 1,000 now nationwide. And so it's good to see that trend. That's that's like literature review, looking at both the scholarly literature and the gray literature for that kind of information. There are a couple of organizations out there like DPC Frontier that have like mapping tools, and there are multiple mapping tools like that you can pull from. And then on some of the other things, like there's a map in there about more of like the direct pay for the healthcare facilities. That's another big part of this report. That's some data that actually it's very straightforward. Putting it into a map is maybe a new thing, but figuring out where those critical access hospitals are, because that was kind of a part of that story. And then basically just drawing a 15-mile radius around those to see then how much of the state is excluded from easy access to direct cash pay healthcare facilities. That's sort of another way of doing it. That's something that you can you can do without needing a lot of secondary data from places. So that's some of the many data sources that went into this.
So will this take something revolutionary to make happen? I mean, the big deal right now, we're dealing with private insurance, direct self-funded plans. We're dealing with Medicare, Medicaid. States have their own things going on. How will this fit into that suite of different ways people currently pay for healthcare? Because obviously, if you have some catastrophic illness or something to that effect, that could be scary to consider, not necessarily being a traditional insurance situation.
Yeah. So I think something like direct primary care works really nicely with high deductible health plans. In fact, if you have a DPC membership someplace, so you subscribe, you probably should have a high deductible health plan. Yeah. The thing that I'm kind of getting at in this report is there's sort of a middle ground too there. So the high deductible health plan will cover you for that catastrophic stuff, the real serious, really expensive stuff. But there's also sort of a middle area of maybe some ambulatory surgeries that you might need at some point during your life. And I think the fact that even something like that can be really expensive scares people off from thinking about this as a pathway. And one kind of the main point of the report is to say that, okay, so we've got direct primary care kind of working pretty well. And high deductible health plans exist, so we kind of have the two ends covered. But if we made a few tweaks, we might be able to get more, a more competitive landscape with better prices for those kind of mid-range surgeries. And then at that point, I think consumers would really feel like they've got a viable, like, full range alternative.
Right.
And then that might there could be people who are interested in direct primary care but are sort of waiting on the sidelines because they think, well, I'm not sure, what if something happens, and where would I go for a surgery, because then it wouldn't be covered or something, and that could be actually scaring them away from the direct primary care. So filling in some of these gaps makes the whole thing, it's sort of a gestalt, it makes the whole thing more attractive, and so that's part of the message here too.
Yeah, a big thing people don't consider, because I feel like when people think health insurance, they think grandma who has terrible health issues and is in and out of the hospital for whatever reason. A majority of Americans are not necessarily in this situation. They could definitely do well with an HSA or the catastrophic level health insurance plans, and this would make that tremendously more effective for them. Like, if they did have, like, I got cut at the workplace, and it's not a workers' comp situation or something like that, to be able to just go to the doctor and say, hey, help me out, here's your $60, $120, whatever it may be, to get 2 stitches on a cut or something, as opposed to being at home going, oh God, first aid kit, what do I do here? Like, most people don't need that huge Cadillac plan by any stretch.
Yeah, exactly. I think for most people, being able to set aside a little bit for years after year, that's something that ought to be an option. It kind of isn't an option right now, because we have to buy so much coverage for a lot. For some people they need it. Not everybody does though. And you kind of lose out on the opportunity to build up any kind of, like, health savings. I mean, so health savings accounts can be a really great tool as well. Sometimes state or federal policy gets in the way, though. It's actually kind of a complicated thing.
Yeah.
If I ever, when I won't be talking about health HSAs too much tonight, but when I do, usually I have to go back and even just kind of catch up on what the latest is, because sometimes they're actually set up so that they can't be combined with other things, and that's disappointing. I'd like to see that changed, actually.
All right, what am I missing? Is there anything else on this you feel like you really want to get out to people?
Yeah, well, check out the report. Like you started off with, it is pretty readable. This is, if you even just know a little bit of basics about healthcare and some of the terminology. I know healthcare as a field, the terminology can be really off-putting or intimidating or something like that. But this I kind of trying to do this in plain English here, and so check it out if you're interested at all in things that can be put into practice here in New Hampshire. It's relevant for that, but it's also something that a lot of states could do. So it has broad appeal, I think. So check it out. So
super important subject that I feel like everyone should be more informed on. Be an informed consumer. Be an informed voter. Just be aware of there are options out there when it comes to healthcare, education. We've talked about immigration, all these things in the last few months with Americans for Prosperity, and this is probably one of the most important things because it affects people of every age, from before they're born till all the way through. And get as much information as you can, figure out the options, and maybe it's time for some changes when it comes to how we handle healthcare in this country. Definitely be sure to check out the link to the report. It will be down in the episode description. Like and subscribe to newenglandtake.com. We'll talk to you soon.